management. So for a little background about myself, I went to undergrad at the University of Alabama. I did the whole work college football thing, but I also got the chance to work at quite a few of the local high schools in the Tuscaloosa area. And then I spent some time in Camp Woodward, which is an extreme sports camp up in Pennsylvania. And what I started noticing about the environments was that there was an inherent difference between not only the settings and the patient population, but the conditions that were beyond anyone's control that were affecting each of my patients. At the time in undergrad, I didn't have kind of any words to put to what I was experiencing or seeing, but then I came to realize that it was health disparities, which is a particular type of health difference that's closely linked with social, economic, or environmental disadvantage, or a combination of all of these. And these health disparities adversely affect groups of people who systemically experience greater obstacles to health, whether that be based on religion, race, gender, socioeconomic status, or other characteristics that are historically linked to exclusion or discrimination. And kind of the underlying factor behind all of these health disparities are social determinants of health, which are the conditions in which people are born, grow, live, work, and age that can affect a wide range of health outcomes and overall quality of life. These different social determinants of health result from the unequal allocation of power and resources and then manifest in those health disparities. So that unequal social, economic, or environmental condition. And so I like to come up with an easy way to explain of what these social determinants of health are. And the way I explain it is a fishbowl. And so what I mean by that is the conditions in which a fish lives dictates its health outcomes. If the bowl is cracked, dirty, or leaking water, the fish will never be able to reach optimal health due to the conditions in which it lives. The same thing is true for people. So people live in conditions shaped by policies and factors that are beyond their control that influence their choices and behaviors over a lifetime. And so patients who live in unsafe environments, lack access to transportation, or just don't have social support will likely have worse health outcomes than those in safer environments. And so if we put it into the context of patient-centered care, a person's health is only minimally affected by the healthcare that they are actually receiving. So social determinants of health account for 50% of the modifiable factors contributing to health outcomes compared to that medical care. So that medical care will only account for about 20% of an individual's overall health outcomes. So a zip code, for example, can be a more powerful predictor of a person's health than their genetic code. So when you focus on only improving the actual medical care provided for a person, you're unlikely to address those health disparities that exist in today's current environment. And so you can provide the best care that you know how, but that'll still only account for 20% of the pie. And so by not addressing the social determinants of health, we're doing a disservice of addressing those individual behaviors without addressing the larger context. And so when we're seeing all these best practices and research that's coming out, it's often missing a level of nuance. And social determinants of health can be that nuance. And so my objectives today, as we go through this quick presentation, is to define what some of those social determinants of health are and to leave you with actionable steps that you can take to help mitigate the potential negative effects of social determinants of health. And so what exactly are these social determinants of health? And so they include, but are not limited to health services, transportation, environment, income and wealth, employment, the social environment, public safety, housing, and education. And you'll notice at the bottom of this little wheel that the spoke above race has a question mark. And race is not a social determinant of health itself, but the structural inequalities that are related to race and poverty can compound the potential negative effects of social determinants of health. And so if we start off with health systems and services, that's broadly defined as the access or lack of access to effective, affordable, and culturally appropriate healthcare. And so health systems and services should be culturally proficient for the patients that they serve. And access to healthcare has quite a few facets. A lot of times people think access to healthcare just means being able to have health insurance. But some other things that we have to consider when we talk about access to care is the service available in their area? Are there any barriers to utilizing the service? And is the care relevant and effective, but also is the care equitable? And so to evaluate access to healthcare, you have to consider those questions, respond appropriately, and ask culturally proficient questions. You should also be considering how an individual obtains, processes, and understands health information, so their health literacy. Understanding the health literacy of your patient helps to reduce the barrier to healthcare. A lot of times, athletic trainers are not only providing healthcare, but they serve as a liaison for patients within the larger healthcare system. And that communication between different facets of the healthcare system for these patients helps to reduce the negative effect of social determinants of health. And so for our next social determinant of health, we have transportation. And this is a multifaceted one. And so it consists of the infrastructure and services necessary for individuals to move around their communities. And the greater access to transportation is often related to that better access to healthcare. So when transportation is limited or designed inadequately, patients may be unable to attend healthcare appointments and delay their care. And for instance, when an athletic trainer is present within an environment, whether that be in high school, collegiate athletics, or in a community environment, it reduces the negative effect of lack of transportation by reducing the need to seek care outside of the environment that they are currently in. And then we have education, which is the access or the lack of access to learning opportunities and literacy development for all ages. And so education can occur in a wide range of places. So that can be school, communities, workplace, as well as the home, and it leads to accumulation of knowledge. And education is so important, particularly early childhood education, because it significantly impacts that health literacy, overall literacy, academic achievement, and health opportunities. It's often closely related to employment. And so why employment becomes a social determinant of health is because it drives other social determinants of health, such as housing, healthcare services, and education. And it's often the primary source of income and health insurance for adults, particularly in the United States. And so employment can affect a wide range of health outcomes because of the use of workplace resources and opportunities. So think access to exercise classes that your workplace may be hosting, or cafeterias and vending machines. Employment can also come with psychosocial burdens and just the physical environment of the workspace. And so when we're talking about employment being the primary source of income, that's really encapsulating the financial status of an individual. And so when we're talking about financial status, there's two things that are commonly discussed: income and wealth. Again, income primarily results from employment and in turn directs that income inequalities. And because income is derived from employment, that source of income means that it can fluctuate throughout one's lifespan. Wealth, on the other hand, accumulates over time and can be measured by assets and debts and provides a snapshot of personal finances and economic resources. Wealth can also be passed down through generation, what we call generational wealth. And generational wealth and wealth itself continues to be the dominant source of health disparities in the United States for people of color. Income and wealth often dictate access to resources, which again impacts an individual's health. Then we also have housing. So as a social determinant of health, housing accounts for the safety, stability, and affordability of a neighborhood and the infrastructure in which an individual lives. Often the health effects related to housing are compounded by other social determinants, such as your income and your physical environment. And research suggests that people with housing insecurity or those living in unstable housing environments may be less likely to seek preventative care or more likely to access emergency services more frequently, to delay the fulfillment of prescriptions, and not adhere to a treatment plan. And so if we go back to our fishbowl example, even when healthcare provides an optimal healing environment, if patients return to a housing environment that doesn't promote health, optimal health outcomes may be unattainable. And so because of all of those different factors that encompass housing, so your safety, stability, affordability in your neighborhood, athletic trainers should consider beyond the patient-clinician interaction and consider the homes that patients return to at the end of the day. And then we have public safety, or the lack thereof, which can affect an individual and the community. The safer the neighborhood in which the greater the likelihood that people will be physically active, take advantage of parks and green spaces, and then athletes who live in unsafe communities may suffer academically, live in fear, and lack positive role models. And then we have our physical environment, which are the natural and built environments that people occupy. So that includes your housing, your transportation systems, access to food and parks, climate change, the air, water, and soil quality of the environment. And so the physical environment can negatively influence health through pollution, lead exposure, unsafe transportation, climate, weather contamination, and can increase the risk of birth defects, cancer, and respiratory conditions. And then the last social determinant of health we'll talk about is the social environment, which is the aspects of an individual's social life, such as relationships, culture, neighborhood cohesion, social norms, and is often measured in relation to mental health. And so communities with more social capital and supportive neighborhoods positively affect health by helping to reduce crime, increase the sense of safety, and provide social support. And so all of those different social determinants of health are interrelated and have the ability to affect health outcomes, particularly following an injury. And so to better understand the dynamic interrelatedness of an injury, the socio-ecological model, a public health model, has been used in the past. So this model presents with 4 levels of influence that can impact health. On your inner circle, you have intrapersonal. Moving out, you have interpersonal, then the community, followed by society and policy. And so the socio-ecological model can help us understand how healthcare providers can intervene on different levels, since the patient and their health outcomes are influenced by their interpersonal relationships, the institutions where they seek care, the communities in which they live, and the societal privileges or constraints they may face. And so if we break it down level by level, the innermost level of the socio-ecological model is the intrapersonal or the individual level, which considers physical characteristics, cognitive characteristics such as knowledge and attitudes, as well as individuals' prior experiences. And these are likely a product of interpersonal interactions. And so social determinants of health that play a role at the intrapersonal level include demographics, socioeconomic status, access to resources, and an identification with specific cultures. And so clinicians can intervene at this level through the assessment of social determinants of health embedded in the subjective history portion of an injury evaluation. That can just be simply getting to know your patient before they have an injury, asking them questions, trying to piece together what their life looks like outside of the athletic training room, or it can be more formal. And so there are several public social health screening tools that can be accessed. First, we have the protocol for responding and assessing patients' assets, risks, and experiences, which is the PREPARE. And then we also have SIREN, which is the Social Interventions Research and Evaluation Network. And these are tools that can be easily integrated into an EMR system to better capture the social determinant of health risk that individuals are facing, or simply put, just create a better picture of what your athletes or your patients are experiencing on their day-to-day life. And so then we move out to our next circle, we have the interpersonal level, which refers to the relationships individuals would have with each other, whether that is teammates, family, friends, the healthcare system itself, or their coaches, and the established social norms in the spaces that they occupy. And so many of these relationships are strongly tied to socioeconomic status, race, and cultural influence. And so social determinants of health present can include, again, those relationships and those social norms. Those are social determinants of health within themselves. And so in a study that we conducted in ROTC cadets, when asked about how they preferred to receive health information and education, they said, if I was going to have someone sit down and really talk about it, it would really resonate more if it came from a military medical profession. And so being in the military environment, they truly valued being able to have a provider who was present in and understood their culture and was able to relay health information to them in a way that was applicable and made sense. And so keeping that patient preference in mind, clinicians can intervene at this level through verbal and nonverbal communication, close contact, frequent education, and collaboration between the clinician and the patient. And so all of these tools together can help to facilitate better health literacy among patients. And then we have the community level. And so the community can be described as the broader context surrounding an individual. So that includes their cultural and physical environment. And so if we take, for instance, their physical environment, in another study that we did, this time with emerging adults, so that 18 to 24-year-old age range, we talked about some of the barriers and facilitators to seeking care following an injury. And one participant noted that their access to transportation significantly impacted their decision to seek care for injuries. In particular, this participant was talking about how she had gotten to campus a week early and was going rock climbing, fell off, and suspected she had an injury. Her knee really hurt, but she was dropped off without a car. Most of her friends weren't there, and she struggled with that decision for a long time trying to figure out whether she should call the ambulance, take an Uber, or how she was going to get to somewhere where she could receive care. And so if we think about the physical environment, a clinical intervention can include developing partnerships with local entities and establishing referral networks, maybe providing transportation vouchers between different local entities. And then we have the outermost level of the socio-ecological model, which is society and policy and refers to best practices. And so that can look like laws and policies on a local, community, state, or national level. And how athletic trainers and clinicians can intervene is through advocacy and promoting research in social determinants of health. That can look like getting involved with your local organizations and your local political action committee, but also pushing for this research to be disseminated so that everyone at every level can see the information that's coming out and be able to use it in their toolbox as they provide care for patients. And so if we bring it back to where we started, as athletic trainers, you probably already navigate these social determinants of health in your daily practice. However, little attention has been paid to the influence of these social determinants of health, particularly in an athletic context. It's unrealistic to believe that we can change everything at once, but as athletic trainers, we do have the capacity to observe, communicate with, and advocate for patients with social determinants of health in mind to create solutions that have a long-lasting effect for our patients. And so to wrap it all up, I hope you take away these 3 points from my presentation today, that social determinants of health can play a large role in health outcomes. Healthcare providers should be aware of and recognize the impact of social determinants of health, and asking more questions and using resources appropriately can help you adjust your practice to be considerate of social determinants of health. Thank you.
Thank you, Brittany.